In 1993, we were moved from Newcourt Hospital. It was needed to close Newcourt into a purpose-built building, modern house. And then on the 7th of October 1998, the Health Authority decided to close Modern House. We had nowhere to go because the health service were no longer taking responsibility. They told us we'd have to find somewhere, and we didn't know anywhere suitable because our needs were quite complex and intense. And so we decided to go to law to fight this decision. We had no experience of lawyers or processes you go through, so simply looked in the yellow pages for a lawyer that had dealt with hospital cases. When we won our case, everyone was excited and relieved and thought, now all these injustices that have been going on, this is the answer. You know, no longer will they have to worry about selling their houses and relatives wondering, you know, if they'd have to leave home. But nothing happened. The NHS still defined healthcare, and they were still imposing very severe criteria for healthcare unlawfully. People in this area in need of this type of care are sick and frail, very often disabled, very often mentally disabled, Alzheimer's or things like that. They cannot, there is no one there to help them. Social services just say, well, their social workers explain the complaints procedure. The complaints procedure is an obstacle course which is impossible for most people or their relatives who are often elderly or unlearned in the ways of bureaucracy to follow. It's an obstacle course. It's impossible for them to follow. It could take 2 years and involve endless correspondence. For example, in the early days after our case, Steve Squires, whose father had Alzheimer's, challenged the health authority denial of funding. It took him 500 letters and about 6 years. He finally succeeded, finally proved that his father with Alzheimer's did fit the criteria. It's cruel beyond belief to expect these people with dementia or who had strokes or later stages of multiple sclerosis, Parkinson's disease, so they cannot possibly enter into this complaints procedure themselves, and there is no one to help them. I don't think the 2007 National Framework Guidance has helped. It seemed to clarify the situation, and I thought maybe local authorities and social services would take the opportunity to rid themselves of this huge burden of debt and the administrative costs it involved. But because the health authority, the NHS still had to define healthcare, the social service were in a bind, really. They had to go by what the health department said, and they were still imposing very severe unlawful criteria for health care. What we need to do is adopt the Royal Commission on Long-Term Care's recommendations. All care in this area of long-term care should be funded by the NHS, as all health care. What politicians and health authorities call personal care or social care is fundamental nursing care for people with long-term care, helping with feeding, dressing, bathing, toileting. They would die without these things. It is fundamental nursing and health care. What I'd like you all today to think about is the plight of the people who need continuing care, who are being denied it, the kind of torment they're suffering really, and the fact that there's no one there to help them. They're struggling out in the wilderness, desperate. Their families are desperate, and their health is deteriorating and being broken. What little help they have is being broken further by all this humiliating and frightening and exclusion from the general society.